probably know I'm Dr. Tejas Parekh, practicing as an orthopedic surgeon here in Mumbai for the last 32 years. And I'm treating a lot of trauma and osteoarthritis besides surgery for joint replacements, trauma, scopies, etc. etc. Now today this small talk is about what you have to do once you get a fracture. So the first thing is when you get a fracture, it is rest, ice, compression, elevation. Okay? And then, of course, then get an X-ray done or consult your orthopedic surgeon who will further guide you once he makes a diagnosis. Now, once you have a fracture, we have to determine whether it is open, that is, it requires emergency management if you are bleeding or things like that, which is done in the casualty, or if it's a closed fracture. If it's a closed fracture, the decision is whether we have to operate. Bone is one of the most neglected of tissues, but one doesn't realize that healthy bones are required for the rest of the body to function well. To maintain good bone hygiene, you need adequate amount of calcium, vitamin D, weight-bearing exercise, and protein supplementation. By that, the bones remain healthy. Now, bones not only form a function of maintaining the skeletal system, they also are a source of calcium which is required for other systems in the body.